Hi, I'm Dr. Chad Duplantis, and I'm a restorative dentist from Fort Worth, Texas. And today I'd like to share with you an expert tip. My expert tip today is going to be on cone beam computed tomography, otherwise known as CBCT in the dental industry. Although it may not technically be the standard of care, it's thought to be so by many in our profession. Over the past several years, adoption has increased rapidly, and it's really nice to see the younger dentists taking hold of their diagnostic capabilities and incorporating this technology into their practice. Through this technology, we can become better diagnosticians because of what we're able to visualize through the images offered from a CBCT. The capabilities of these systems are vast. We can use this to enhance so many areas of our practice, including sleep dentistry, implants, oral surgery, TMJ evaluations, pathology, endodontics, orthodontics, periodontics, and the list just continues to go on. In our practice, CBCT has replaced our traditional Panorex imaging. We take a diagnostic or increased field of view every 3 to 5 years just to get an overall view of what's going on in the patient's oral cavity and the surrounding structures. It's really important for us to note that when we're utilizing CBCT, that unless we're taking a fully diagnostic image, that we refer to the region of interest, which actually dictates the field of view for the CBCT. For instance, if we're looking at a problem associated with one or two teeth, we don't need an expanded field of view. We want to take that down to a 5 by 5. In doing so, this minimizes the radiation exposure to the patient. So it's really important that we look at our region of interest, which in turn dictates our field of view. Reading these images is a must, and it's something that we need to stay on top of. It can be a cumbersome task if you don't really understand the image that you're receiving from the CBCT. So I'd like to refer upon a colleague of mine and a mentor, Dr. Jeff Horowitz, who taught me an incredible technique to review and interpret CBCTs. It's a real simple acronym called the PANTS technique. The P stands for the Panorex. Each of these CBCT systems creates a two-dimensional Panorex in addition to the three-dimensional views of the CBCT. That's the first thing that we look at. We take an overall view of the Panorex in 2 dimensions, and then we can start to annotate some things that we need to look into further in the 3-dimensional image. The A stands for airway. The CBCT allows us to visualize the airway, and it's a great tool to help determine the risk of a patient for obstructive sleep apnea. We can measure the airway utilizing the tools with the software from the CBCT, and in turn, we can create a volumetric analysis of their airway and determine if they're at risk of obstructive sleep apnea. The N stands for the nasopharynx and sinuses. This is what we're going to look at next. We're going to look at the anatomy of the nasopharynx and note any abnormalities. The T stands for the temporomandibular joint. Although this is not present on every single CBCT that we take, we want to make sure that we analyze it if it is present on the field of view that we've taken. In addition, these CBCT units can actually take minimized images of each of the temporomandibular joints, which is a really nice specific image when you're looking just at the TMJ. And finally, the S stands for segmented arches. I look at both the maxillary and mandibular arch in 6 segments. So 2 posterior segments for each arch and 1 anterior segment for each arch. And that really allows us to zone in on the teeth and the surrounding structures and see if there's any issues within. Once we've incorporated this technique, I promise you it will really help you to interpret and analyze the CBCTs that you take into your practice. But it's important that we also note that when we take these images, we're not radiologists. We're experts in the dentition and the surrounding structures of such. We need to rely upon the radiologists that are available to us to read these images and interpret them, because ultimately we're responsible for everything that's contained within those images that you take. So in these instances, I would highly recommend that you send these images off for review by a licensed radiologist. There's a company called Dental Ray that offers this service, and they do a great job of interpreting these CBCTs to limit our exposure. So in closing, I'd just like to share with you that CBCT technology has drastically changed the way that I practice dentistry. It has the potential of making you a better diagnostician and, in turn, a better clinician. The amount of information that you gain from a CBCT is vast and it's truly invaluable. I really believe that this is quickly becoming the standard of care in our profession. And that is my expert tip.